Welcome back to Q13 News this morning. There's a new shingles vaccine that it's actually recommended that if you've had chicken pox, and even if you've had a shingles vaccine before, you probably should think about getting this new vaccine. So this morning, Dr. Elizabeth Meade with Swedish Medical Center is here. So we've been talking a lot about these recommendations. I think we're confused about them. I know people at home are confused about them. So is there a new shingles vaccine? Why do we need to get this?
There is a new shingles vaccine, and it's actually really an exciting development because this new one not only protects more people, so this one is over 90% effective, whereas the previous one was about 50%, so it's a big improvement. It also lasts longer, we think, and it's not a live virus, so more people may be eligible who couldn't get the previous one.
Okay, so let's back up a little bit because I'm not even sure I know exactly what shingles is. I mean, I know it's associated with chicken pox. What is it and how do I get it?
So basically, when you're infected with chicken pox, after that acute infection goes away, the virus kind of stays around and it lies dormant in certain nerve cells in your body, and it can get reactivated. So in times when people are very stressed, if their immune system is compromised, or as you get older, it may get reactivated, and typically what it causes is pretty severe burning, tingling pain. Usually it's on one side of the face or the body, and then it can have a blistering rash as well.
Well, that sounds awful.
It's terrible. I mean, it's so painful. It's really uncomfortable for people, and it also can lead to some significant complications. So people may end up with something called post-herpetic neuralgia, which is pain that can last months to years. You can also end up with deafness and blindness, so it really can be pretty terrible.
And anybody who has had chicken pox is potentially susceptible to this.
That's right. So anybody who's had chicken pox can get it. Lots of people don't know if they had it or not, right? I think it's good to assume that most people had it if they're in that older age group. It's really important to note also, though, that people who have been vaccinated against chickenpox have a much lower risk of getting shingles than people who have had the natural infection. So it's another great reason to make sure your kids are vaccinated too.
Yeah, because that's a new development. I didn't get it when I was a kid, but my kids have had chickenpox vaccine. Okay, so this new vaccine, if I got the old one, do I just go in and say, hey, I need the new one? Who should do it?
Yep, your primary care doctor is a great place to start because they'll have all your records and they'll be able to tell you. But yeah, people who over 50 who are healthy generally should get this new vaccine, even if you've had chickenpox and even if you've had the previous shingles vaccine.
Okay, so 50 years old, think about talking to your doctor about this. Are there any risks with this new vaccine? Any side effects?
It's mostly the general side effects that we see with any vaccine, so a little bit of redness or swelling at the site. Some people might feel achy or kind of headachy, but usually it's just for a couple of days. I can tell you it's much better than getting shingles.
It sounds like it as you describe it. Yes, I think this is great information. I think it's important for people at home to hear this. If you're 50 years or older, talk to your doctor about this new vaccine.
Yeah, there are very few people who won't be able to get it for certain medical reasons. So if you have any question, talk to your doctor. But for everyone 50 and over, we're recommending that you at least check it out and make sure if you.
And this is a great science story too. I mean, basically, it's this great breakthrough.
It's a great development. I think this is just one of the ways that vaccines continue to improve and be more protective and more beneficial for everyone.
I feel like I have a much better handle on things.
Good.
As always, I appreciate your being here. Thank you very much.
Thanks for having
Dr.
me.
Elizabeth Meade with Swedish Medical Center. MJ, over to you.
Thank you. I have a question too. If you get it just over 50, are you done for the rest of your life, or do you think you need a booster later on?
Good question.
We think that it's probably protective for the remainder of your life. So because it's a newer vaccine, we'll be continuing to look into it. But
great. Thank you.
Yeah.
Awesome. I get to ask a doctor questions for free over here. Okay.